Technical difficulties, bear with me. Welcome, everyone. We'll get started in just a moment. Good to go, Ajwa.
Thank you. Hello, everyone, and good evening. Thank you for joining us. Please be sure to type in the chat where you are joining us from. We'd love to know where our audience is and how we can all get connected when all this is over, because it's wonderful to see all the work that's being done across the US and overseas. So, as we're waiting to get started, please be sure to drop it in the chat. Oh, I see one person from Baltimore, Maryland. I'm a Maryland girl myself, so I won't say born and raised. I just was there for a little bit. So we've got New York, Illinois. So please keep them coming and we'll get started shortly. Thank you. Right. I see a couple more. And so we're going to go ahead and get started. We've got a good number already. So we're going to go ahead and get you going because we've got some great information to share. So, welcome everyone to the Safer Births Now workshop. This is, you're in for a treat. We've got lineup for you. Great information to be shared. My name is Adjoa Eyesu, and I am the moderator for this evening. My background is it's a lot of things, but primarily I am a full spectrum doula. Birth is my passion, postpartum is my heart. And so, thank you for joining us once again. And we're going to get started. The title of this workshop the title of this workshop is Your Passport to Perinatal Power: Simple Steps for Safer Birthing. And so on the panel today, we have Jennie Joseph, Katrina Nelson, Selena Brown, and Brianna Boynton. They will be sharing with you a lot of wonderful uh, to say tips and suggestions is very much an understatement. This is very much a way to navigate a safe birth for you, loved ones, community members, and all those in between. Before we get started, I just want to make sure that we are all grounded. We came here with open minds, but most importantly, open hearts. For most of us, birth work is not just a career, it is definitely a calling. And so I just ask that you take in what you are hearing with a lot of intention because, especially in our community, we never know whose life this could be saving and where you can pour into somebody else on their birthing journey. And so, without further ado, I'm going to turn it over to Jennie Joseph, and she's going to get started.
Good evening. Thank you all so much. It's such a honor and a joy, with such gratitude that we come today from CommonSense Childbirth to share with you, and we are looking forward to a robust Q&A at the end of our presentation. So get your questions as they come in, hold on to them so that we can dig in afterwards. Because one of the things, just like Joe said, we are passionate about this work. Whether you are the birthing person, the family of the birthing person, the neighbor of the birthing person, or you are a birthing professional or provider, here's what we're going to do tonight. We're going to keep it real common sense because what we know after nearly 30 years of organizing and working through this organization, we have found that there are some very straightforward, simple, and reliable ways to keep people safe. In our years of practice, never lost one mother. Any baby that has been lost has been through congenital abnormalities that were not preventable. This model works, and we want to share and we want to hear from you in your work which models are working and how we can all share these tips and work together to make sure that we eradicate disparities, whether racial, class, discrimination. We will eradicate, and this whole ecosystem in the United States will become once again a safe place, a safe environment for not only the birthing families, but for the providers who care for them in community. So, some of you may already know, I made up a little model when I got off a plane in 1989 because I was a midwife in the UK for 10 years before I got here. And I came without any clue. I didn't stop and do any homework. I didn't research. I fell in love. I was like, yes, stars in the eyes. Let me go to Orlando and live the Disney lifestyle. And that didn't work out so well. Because once I got here, the first thing I realized was that people didn't even know what a midwife was or not actually even care what a midwife was. And
Mm.
at the same time of recognizing that, I also realized the most outrageous and egregious statistics, including infants and mothers, were rife in the United States, the most resourced country in the entire world. Did not make sense to me. How could we be losing mothers and babies at such rates, particularly babies from marginalized communities? Mothers from marginalized communities. What was going on here that wasn't going on in any other continent or country in the world? Oh, here's the answer. Every other country and every other continent has midwives and has always had midwives. Midwives have stood with women and families through birth for millennia. And imagine that not having midwives in this country has been to our detriment because when we had midwives, midwives delivered America after all. African midwives who were enslaved delivered America. Indigenous midwives delivered America. Immigrant midwives delivered America until they were stopped. And we have now, as a result of that, these outrageous numbers, these outrageous harms, the situation where particularly women of color, people of color who are birthing are scared out of their mind, worried that they may not survive the event, worried that their baby may not be able to be strong and whole. So CommonSense Childbirth was developed because of the lack of access to safe care, quality care, culturally respectful care. And we had to do that in community space because guess what? I wasn't allowed in the hospital. They were like, what do you mean you don't have a registered nurse degree? How could you possibly be a midwife? Get away. We don't want you. So I began in the early days, in the late 1990s, doing home birth because it was the home birth community that was looking for me. They were the ones that were interested in what I had to offer, and they already knew what they wanted. But the problem or the difference was that there were a handful of those people. They were mainly white, very homogenous, very, affluent. They had their agency and power already. What I offered to them as a midwife was very useful to them, but it wasn't a matter of life and death. And as I began to expand that practice and diversify that practice, what I noticed was that our outcomes were as a direct result to the quality of the care we were receiving. So, as a midwife doing home birth and trying to build out a practice for women who looked like me, I had to come up with some tools to engage those women. They had forgotten the history that the Black midwives ran the entire country at one point as far as midwifery and maternal care. They had forgotten and even were concerned that their grandma did that, but they didn't want to do that, right? They had forgotten that there's a way to be supported through pregnancy, birth, and postpartum that will keep you safe. And so, in order to engage and encourage folk to consider this way, I created this thing, which is not original. It's called the passport. And it's literally a little trifold card. We're going all the way analog now, right? Cast your mind back to when we didn't have everything digital, right? This is simply a piece of paper which we use to put the information that every pregnant person needs throughout their care. We have a space for appointments. We have a space for their lab work. We have a space for their prenatal visit, blood pressure, weight, urinalysis, etc. And we complete it every time they come into the clinic. On the back, we have the most important parts: danger signs, preterm labor signs, and a number to call so that someone will answer. These rudimentary and straightforward ways of being, we put them into this passport card. We handed every patient, whether she was having a home birth or a hospital birth, this card so that she and her partner always had all the information in their hands wherever and whenever they went anywhere during their pregnancy. This is prior to electronic health records. We're talking about 1998, 2001. But many of you may not have even been born, right? But we were using this model to make sure that our patients were as empowered as they could be. And this was built around the model I called the JJ Way, right? I created the JJ Way framework to make sure these kinds of tools could be utilized. And so this is an access point, right? This little card gives you access to phone numbers, emergency line, instructions, helpful tips, so that you can have complete, unimpeded access 24/7. You didn't have to be our patient. You didn't have to stay with our clinic if you wanted to move on to an OB or you needed to go to the maternal fetal medicine. Didn't matter, because you had a tool where you had some power and autonomy around yourself, your pregnancy, your baby, your family. We put the framework together to make sure 4 tenets were applied every single time. First one being access. So access to that passport is a lifesaver. Connection. People who have a sense that they can trust you, that you believe them, that you will listen, form a strong bond, a strong connection. And for some reason, that makes the difference for the physiological outcome. We started noticing that people who had previously had preterm births didn't have a preterm birth, that the baby's birth weights were healthy. We noticed that the fathers and the partners were involved and glowing and proud and protective. We noticed that the grandma, the extended family, everybody felt connected because we were working in this methodology. Knowledge was the third tenet, sharing information, but also asking them to keep providing us with the knowledge and information we needed to keep them safe and healthy. And in the end, everybody was empowered. So again, this is the passport that we have created, and we still use it to this day, to make sure everybody has the access, connections, knowledge, and empowerment to their healthiest birth. So I'm going to hand over now to Selena Brown, one of our brilliant midwives at CommonSense Childbirth, and she's going to share a little bit about how the passport has been a passport for her as well as for her patients.
Hello, everybody. Thank you for joining us. So, yes, I will speak from the provider standpoint of how I utilize the passport and what that looks like with the patients, the families, and then also what it looks like for our community and how we communicate to other health providers. So the passport, it's actually kind of fun is what I like to say, because I can use it as a way to talk to the patients, talk to the families. It's a tangible way for them to be able to see like what all is going on between each appointment. And we sometimes have a little fun with it. We'll do like a quiz, a pop quiz. Tell me one thing that you can remember that is a sign of preterm labor. And everybody gets to join in and try to come up with what they think is the answer. We celebrate if they get it right. We talk about it if it's wrong. And so it's a way to continually educate everybody in the room and get everybody involved. So the other thing that I've noticed they really like about it is that emergency number. So they can call me at 3 o'clock in the morning if something's wrong, that Jenny's showing you there. And what that does is it helps them feel safe. It lets them know that there's somebody that's really caring for them. They're like, favorite question, you're going to wake up at 2 o'clock if I call you? I'm like, of course I'm going to answer the phone for you. And so they love that, because it's not that like they're having to come to an answering machine, hope that somebody's going to answer. And if not, they have to go see the hospital and go from there. So the super important thing is knowing that they can reach me at any time if any of those signs are happening. And then well, I actually want to share a story. So this past week, I had a new mommy. She was having some blood pressure things going on. Not in a critical sense yet, but we were starting to see some numbers getting a little high. So we talked about preeclampsia, of course, and we also talked about some maybe things that could help her, like increasing her water. Let's add in some more exercise. Let's look at our diet. And we looked at the numbers together, picked up the passport. We looked at the different changes. We talked about it. And I saw her 2 weeks later, and her blood pressure was amazing. And I said, well, what did you do different? I said, did you do something different? And she said, I did. She said, I saw the numbers. And so she said, I was paying attention to what I was eating. And she said, I even went to my gym that's at my complex. And I said, oh, that's so good. So we got to celebrate that. And that's one of the ways that we're able to use it in like just an easy, tangible education point. And then in speaking with like the healthcare providers, so they all know, we drill it in their heads. Make sure you carry your passport everywhere you go, because it's something that if you ever need help, there's somebody that can quickly see what's going on. Your labs are there. If they need to reach the midwife and tell me what's going on, they have it right there to call me. And so everybody knows to carry it. And for another provider, it's nice because now they're not having to, like we said earlier, wait for records. They're not having to get this information from the pregnant person or from the family. They could be in a crisis event. We don't know, but it would be hard for them to communicate that information. And so it's something quick and easy that they can reference to be able to help the person that's in front of them. So that's a little bit about how I use that as a provider and how it helps with education and to be able to get quick help if needed.
Thank you, Selena. That's wonderful. And you see how she's wrapped in those four tenets: access, connection, knowledge, empowerment. All of those things happen organically just by using that passport card. All right. So I want to introduce the lovely Katrina Nelson, who's going to share a little bit with us about how she has been. Well, let me let you speak, Katrina. Go ahead.
Hello, everyone. Thank you for joining us. My name is Katrina Nelson, and I'm the Director of Health Services at CommonSense Childbirth. And I have been with CommonSense for 23 years. And in the 23 years that I've been with CommonSense, at first we didn't have the passport. So when Jennie created the passport, it was a total game changer. Just by, at 36 weeks, we send our records to the hospital for the patients, just their update if they're delivering at the hospital. And sometimes, as you know, with the fax machine, the paper charts, there's no paper in the fax. They didn't get it. Something happened. And the patient shows up at the hospital in labor and they don't have any records. So they have to call in the middle of the night. They need the records. Well, back in the days, we had paper charts. So we didn't have, electronics to where we can just fax it right over on our laptops. So it was kind of hard. So when Jennie created this beautiful trifold that we love so much, it had everything on there. Like they all said, it has the weights, it has the blood pressures, the urinalysis, it has the future appointments, it has the danger signs. So everything is right there in the patient's hand at a glance. So if a patient goes to the hospital now and they don't have the records for whatever reason, on the passport, it has the ultrasound, it has the labs, it has the last menstrual period, it has everything that they need to start the evaluation. So it doesn't have to interrupt care for the patient.
Thank you, Katrina. I think it's so important for us to realize how having this in the hand of the patient, in the hand of the client, has helped bring midwifery wherever they go, right? So it's not now like relegated only to those who choose, I want this natural home birth, I want a water birth tub, I want some lavender in the oils. No, this is for any pregnant person at any site with any provider, because now we've centered that person as being the owner and keeper and autonomy that this gives them to bring midwifery into the room wherever they are. So I'd love for Bree to join us and speak a little bit now, because she's also going to help us understand. It's not just for the clinical.
Hi everyone, my name's Bree. I am the Perinatal Safe Spot Development Lead for National Perinatal Task Force. We are a program of CommonSense Childbirth, the national program of CommonSense. We have a membership of over 400 members, 400 perinatal safe spots. We have amplifiers and we have our igniters. I'm really excited about the passport because it really allows trust and safety to come into the picture. It also just puts the knowledge and decision making back into the hands of the birthing person. So it allows people to have real autonomy, not over just like their body and their care, but like actually in practice. So within our perinatal safe spots, we have toolkits that they can access, and this passport is actually in our toolkit. So instead of holding it in, it also creates like a trust between us as CommonSense Childbirth and our perinatal safe spots as well, because we're not gatekeeping this. We're not holding this in and saying this is ours. We're sharing it with others so they can create safety and can create these wonderful numbers that Jennie and Katrina and Selena and everyone else that's been a part of CommonSense and the health services has already done. And I also will say that I have actually seen it like in practice in real life. I traveled to Dallas and I went to Abide Birth. And they are an easy access clinic like the health services is in Orlando. And they actually use the passport. So it was really interesting to see like in real time, midwives coming in and having that passport in their hand with the clients and going over it, and the clients just really feeling like empowered. And that's so important to see that like it's not just in Florida that it's happening, it's in Texas that it's happening. But because that this is also with the National Perinatal Task Force, anyone can access it.
Thank you, Bree. Yeah, I mean, I think this is really important. If we're looking at the title of this presentation, right, we're talking about building perinatal power. So as we carry on, I want us to think through from the perspective of just applying a simple framework like the JJ way: access, connection, knowledge, empowerment. How does that build power, right? Because the families have some empowerment at the end of being able to use this. They feel that they have some, additional confidence, additional opportunity to speak and be very clear about what they want and what they don't want, what has happened and what isn't happening. They have, at the end of being able to say, we've had this experience through our pregnancy, even in our labor and delivery, and maybe in the postpartum, we know about our own body, we know about our own care. That's power, right? That is life-saving power, because remember, much of these ills and harms aren't actually physiological. These are ways of being that come at our patients, our clients, at their most vulnerable times. When somebody refuses you an opportunity to make a decision because they're rushing you to sign the stinking paper, or they have to get you off that bed because they need the room, or whatever, any of those horrible ways, the systemic ways, the historical ways of being are happening to you. Something as simple as this gives you a little bit more strength and agency to stand up for yourself, to advocate for yourself. We know that this has made a difference, for example, in our cesarean section rate. So, as you've probably gathered by now, many of our patients, if not the majority of them, are still choosing hospital for their delivery, even though they've accessed midwifery care for prenatal care and postpartum care. But what they've also done on their own, because this is not because we go to the hospital with them, the midwives don't go, the doulas don't go to the hospital unless we have enough staff, which is not that often. We're so busy. So they are at the hospital in labor by themselves. And somehow, in the same hospitals where the C-section rate is 30%, 35%, our C-section rate hangs around 15% every year. In the same hospital where the NICU has 160 beds, and those 160 beds are full of black and brown babies, our families go in and out of the same hospitals and take their babies home with them when they get discharged. Power. And then there's the power of the provider, right? Because you then have a little bit more credibility. I hate that we have to fight from these angles, but the credibility that we have as providers, especially community providers, will impact the care that our clients receive as well. Okay? One of the most important access points to power is real talk. I have a hashtag called "It's time to tell the truth." As long as we want to pretend our way around and, play around with what's so and actually not acknowledge the truth of what's happening, we will not be empowered. We need to find power from a stance of, we know what's going on. We are professional. We have it together. We are working on purpose to improve the quality, the safety, and the equity for all parties, clients and providers. We want to collaborate. We are colleagues. We want to be on a level where we have dignity and respect, just like we expect the same for our patients, our clients. Again, this little thing, it is the most rinky-dink of things that you could think of, right? But look what it can do. Look what it can do for you. So let's go into our Q&A and I'd love to hear from you all, particularly on, the question of power. Do you see and what are you using that helps you bring power to yourselves, your practice, your family? And do you see something like this being helpful? Or have you got something similar that you're using and you'd like to share with us?
Thank you so much, Jenny, for that. And as you guys are typing the questions, I do want to thank you, ladies, for that wonderful insight. Jenny, every time I hear you speak, the passion it's just always there. And so I just want to thank you for sharing your heart and really just kind of the spirit that you poured into this work with us. And so far, I mean, my paper is full of scribble scrabble, but the passport, phenomenal, phenomenal, phenomenal. And from what I have heard so far, what it does is it allows for transparency between power is mentioned so many times, access, sharing, bring everybody together. This collaborative effort allows for transparency. We have to know what's going on. It shouldn't be that a family expecting a baby is going from one place to another and it's, well, we didn't get those records and we're not sure and we don't know. And who is this person and who is that? We should all be having the conversation. We should absolutely be having the conversation and having it again. It's 2026. Everything is digital. Now to have it physically in your hand allows for that transparency. And we all know what's going on because everybody should be held accountable. When a mother loses her life, when a baby is, we all have to be held accountable. Where did we drop the ball? And
Mhm.
so I think this is a phenomenal tool. It keeps us all on our toes. And it also allows, as a postpartum doula, it allows for the mother and the family to look back on the experience and know exactly what was happening. So what's pregnancy and childbirth has become so passive, unfortunately. And we have to allow these families to be more active in the process from start to finish and beyond, because postpartum goes on way beyond delivery. So I'm just phenomenal work, ladies. Thank you so much. And so we're going to take it over to the chat now and look at some of the questions. Um, First question I have is, how does the model utilize doulas, midwives, and community health workers alongside traditional physicians?
That's a really great one. And in fact, if I may, I see Evelyn here on the line, and Evelyn is one of our community health workers at CommonSense Childbirth and a brilliant support to our work. And I think you might want to address that, Evelyn, because you do this on the daily.
Hi, good evening. How you ladies doing?
Um,
Um, well, I'm so glad you went over. Give me one sec. I apologize on that. So, as a medical assistant in Common Sense Childbirth, always being with our moms, and as a health worker also, you have to connect everything. So basically the passport, what it does is it's gonna help us. Why? Because let's put, for example, when we have a mommy that we need to send her to MFN, so maternal fetal medicine, because maybe her blood pressure is going up and down, or maybe for a gestational diabetes, we are, at least on my point of how I help them, is that if they're not able to get that appointment as soon as possible, I'm going to be able to help them to get that appointment. And then sometimes for them having the passport, even though we do send the records, when they get there, sometimes, you know how sometimes the doctors are OBGYNs, they said they haven't received it. So it helps them know, okay, this is everything that has been done. One of the things that we add to the passport also at the first appointment is that we add the pre-pregnancy weight, and
Hmm.
we add the height of the patient. The importance about the pre-pregnancy weight is because it's going to let that MFN and us how much weight the mom is gaining, because there's a certain amount of pounds that it's considered what they're supposed to be gaining. So it helps us. It helps us that if they are out, some of our mommy goes to the WIC form to apply for WIC. They already have their hemoglobin there because it's listed on the labs. So they
Right.
don't have to be, when they go, they don't need to be pinched. So as a health worker, you also help them with the passport because they got everything there that they need when they go anywhere else.
I love that answer, Evelyn. And I think one of the things that's sort of not even written down on a passport because there's no particular space for it, but what happens is the mental health, right? There's nothing more empowering than knowing all your information, even if you're nervous. I mean, which pregnant person isn't a nervous wreck, right? But you can open it at any time. You can see your lab results. You can see, oh, I've got one of these danger signs. You know what? I've been burning when I urinate. It's on the back of my passport. This has helped health literacy as well as health navigation, as well as mental health support, as well as a sense of, I think, autonomy and agency, right? If you put it back into that, centering that mama, there's no question you're not you're centered. Like there's no like, I wonder if they know who I am. Doesn't matter. I know who I am because I'm centered right here. My staff, when they receive me, they also know that I know, and they work with me as if I'm a human being, that I am intelligent enough, that they respect me and they meet me where I am. All of those things show up. So as you're doing your work, you can use the tool like this without having to be so medically inclined as a maybe you're working in a doula role, maybe you're working as a lactation supporter. Whatever your work in the perinatal ecosystem, this will help you too. And so there's a win-win because, the whole model, the JJ Way model is set up to make sure everybody wins every time. Our tagline at CommonSense Childbirth is every person, every time. So you can't not belong if you have a passport, right? That is your entryway, which is why it's called a passport. See the play on words there? Like, I know it sounds horrible, really, especially in these days and times, but nonetheless, and we also have it in Spanish, so we do run Spanish language clinics where we have native speakers only in our Spanish language clinics, and all the materials are in Spanish for them as well. So,
And
Thank you, Jennie.
I will say, I'm speaking from the doula standpoint too, like it has the vital signs on the passport, which I love from each appointment. And if my client went to the hospital and I'm there with them and their partner, so many mothers deal with maternal health issues after birth, postpartum. So postpartum preeclampsia, if I know that her blood pressure from the passport was this, and then now it's like super high and that's not normal, I have a way to advocate for her. So it not only creates the advocacy for the patient, but for the people, her birth team around her.
Very true.
Thank you. Thank you, ladies. I have a question here from Leslie. Leslie says the first report of elimination of disparities at the Easy Access Clinic was 2015, showing that support is a powerful solution. Is there a campaign to spread the JJ way?
Thank you for that question. I'm doing my very best, and all the time, our goal is, can we scale this? Like, it's like getting the cure for cancer and then saying, oh, well, we'll just keep it quiet. We want this work out there. We want this methodology out there. We are pushing through telehealth right now to get this into the hands of providers anywhere and anyhow, because these simple pieces are part of putting together a strong safety net for any person, wherever they're choosing to be seen for their provider or their delivery or their postpartum. That postpartum space is wide open. Think about it. Oh, how many states now have Medicaid going out for 1 year postpartum? Well, that's great, except for who are the providers? Oh, yeah, the same birth workers that we're steady ignoring. So, yes, we're trying to scale this model because our providers who are on the ground already, they exist in our ecosystem, but have not been empowered, have not had the tools, and certainly can't get their claims paid. That's a stinking mess. So we want to scale and we want to incorporate all of the supports to keep the models like the JJ Way, like the Easy Access Clinic, like telehealth for healthcare providers, like the passport card. We want to see that grow because if you think about it, models that work, if we were exporting this overseas, we wouldn't have any problem at all getting this done. Off we go to the mission field to save the day. And here we are in America floundering. Sorry, I got on a soapbox. Did you notice? That
No, we
wasn't the
love it.
question.
It's the passion. It's the passion. We love it. Thank you. The next question is from Alicia. Alicia, piggybacking off of Leslie's question, I believe, is the passport available for others to use or just your company? And if so, is there a PDF to download?
Brianna, do you want to answer that one?
So, like I was mentioning earlier, we do hold the toolkit within National Perinatal Task Force as well. It's in our toolkit for perinatal safe spots. Perinatal safe spots are BIPOC providers doing perinatal work. So you are more than welcome to email hello@perinataltaskforce.com, and our admin assistant will get with you and get that to you.
And Brianna, would you, I think that information will be uploaded in the chat before we close out our session. So just in case anybody didn't get that, if you want to see it written out, it will be put in the chat or sent out in an email following this discussion. Thank you for that. So the next
when you
question,
when you get your PDF, you can customize, this is just ours, but do you, right? Like, we don't want you to be all caught up in, proprietary, IP. Just calm down, do the passport, make it make sense, right? So as long as you go through Brianna, she'll get it to you.
Love that. Thank you. Thank you. So the next question is, how does the JJ Way proactively identify and soothe the chronic stress, also known as weathering, that Black and brown birthing people carry into the room before a single medical exam begins?
That's Katrina. She's got to answer that one because she created how this model works since 23 years ago. Go ahead, Trina.
So with the passport, um, wait, let me make sure I understood. Can you repeat the question again? I'm sorry.
Let me read it again. How does the JJ Way proactively identify and soothe the chronic stress, also known as weathering, that Black and brown birthing people carry into the room before a single medical exam begins?
Okay, that's what I thought. So with the JJ Way, there's stations. So station one is reception. When they first walk in the door, they're greeted with a smile. They're also called by their name because we know our patients. And then it goes to the station two. That's our doula, community health worker. We're in the classroom. They're playing pregnancy bingo. They're just talking about, did you drink your water today? Taking your prenatal vitamins, just making everybody connected. Station three goes back to the medical assistant where they can go back and talk about, what's going on with them. And they get their vitals in private. And that gets them ready for station four, which is the provider, which is the midwife that will, finish off the visit. But you have four stations that you start with. And each one of those stations, every person has a connection with that person and they help them go through, whatever they're going through, they work it out with them. They can talk to them about different things and they just relate. So from the front desk, from when they first walk in, hey, Selena, how are you? Hi, Jenny, how you doing today? Look at your belly. And then, hey, let's do pregnancy bingo. It's just it changes their mood and makes them feel like, they're understood and they're heard. And they go through all of the stations to when they're done, they feel relieved.
I do think, and thank you, Trina. I think it's really important to stress too, kids are welcome, partners are welcome. The neighbor lady who dropped you off, she's welcome. Like it's a complete family, like open plan kind of thing. Like we don't have a glass window at the desk. Like we've never had a separation of you're standing there wondering, is anybody, can you even see me? Like none of that happens. So you can take out a sigh of relief. The amount of tears, especially the first time visits, people are like, you mean I can get seen today? You mean we're not going to have an argument at this desk about the stinking insurance? You mean like, like there's a shock, like, and also our families come from word of mouth. Very few are just cold calling and trying to find us. People have told them, you can go over there, they're going to take care of you. We've also tried really hard to match our community, right? We have folk who are able to feel culturally seen and understood before we even get started. And I think the most important part, and again, I'm going to just go back to that passport as being the key, the link to all of this. They know that once they're traveling with this, they have some sort of added like security. Like you can fly into that triage and you might be told normally, go sit in the corner. And when, yeah, we don't care that you're in pain or in labor, right? Go sit and wait in line. You wave a passport, they're like, oh, she's Jenny's patient. Let's go. And the nurses are like, all scrambled because they're like, because they know if you mess up, we're going down there. We go all together, if we have to. We're going to descend on that triage with donuts. And we're going to be like, what happened? How did this, what? We heard. And so this is a way to make sure they know even before they get to us that they are safe. This is a no judgment zone. This is no shame, no blame. We don't care if you haven't got your insurance yet. Let's get going. We'll figure it out. There isn't any reason why you will not get seen if you come to our clinics. Even on the phone. If you just call in, we will talk to you. We will triage you right there and then to figure out how do we get this sorted so that we can get you rolling. So again, stick with those four tenets. The first one being access. Unimpeded access that is non-judgmental, that is safe, that sets you up from the jump with, you're okay over here, sis. We got you. Now we can get to the other part. From there, that access, because it's authentic and it's clear and straightforward, there's no subterfuge, there's no trickery, there's no gotchas in the access. Once you go, you can then relax and you begin to trust. So your connection is going to be a solid connection. It's a two-way street of trust. That's where the safety shows up. That's where the cervix locks tight. That's where you will get that child all the way to term, probably to 41 weeks, and you'll be crying and begging for us to do something about that. But we are like, ha ha, this is what we do here. You will get a term baby. That's what that does for you. So that weathering that you can expect at every other provider is not present, nor will it ever be.
Thank you. That's very powerful. That is the key in serving our community. The weathering, women walk in with it, they carry it. It carries them along with the pregnancy, and having that space to just say, "Hey, relax, breathe, sis. It's okay." Before they even get started, it makes such a difference. You can see it on their faces where they go, "I'm okay. I'm safe." And those words to a person of color, it makes a huge difference just in the projection of where it's going, because we walk in, again, African American, we have that face. The face it really is a protection mechanism. It's not to be on the defense. It's just, I've been through some things and I have to protect myself again. I have to protect myself. So very important to maintain that from the beginning. Um, I have another question here. Is there a formal referral if the person needs support from a mental health professional?
Selena, do you want to get that one?
Um, so to answer it short, yes, we do spend a lot of time going out getting vetted resources. Katrina and I have actually been doing that a lot lately. So we've been going out into the community, meeting with different people and getting information and meeting them, so that we do know who we're actually referring our patients out to. So we do have a list that we utilize depending on the situation and insurance, of course, or self-pay, that we can refer out for mental health support as well. But we also have started our telehealth mental health program, where we have implemented more screenings for our patients. And then even if somebody were to call in, where we do check on them throughout their pregnancy, throughout the postpartum period. And then sometimes just that contact part will help them. But then there are other times that we do refer out for, higher services if needed.
Thank
But
you.
to just piggyback off of what Selena said, anybody can call us. We don't turn anyone away. They can call us and we are going to help get them what they need. If we can't help them, we're going to refer them out. So we will take anybody. If they're not even our patient and they need help, they're crying for resources, we are there for them.
Wonderful. Always good to know that at least it's a starting point. Again, most people say, you won't turn anybody away. It's a pivoting. We will pivot you in the right direction. Even if it's not here, we will point you in the right direction and take you to the next steps. So that's very helpful to know. Thank you. I think we have time for one or two more questions. The next question is, what role does low intervention play? Does the model strictly forbid medical intervention, or does it redefine when and how those interventions are used?
You know what? That is a really brilliant question, because this is one of the things I've noticed. I've been in America a long time now, obviously, but around the rest of the world, because midwifery is the normal way to manage healthy and straightforward, maternity care, there's not the same emphasis as there is here on intervention, in the way we have created the art of overdoing intervention on every step of the way in maternity care, and then drop you off on the end 2 days postpartum with get on with it for the rest of your life, right? So when I was in other countries, and I've worked in other countries, trained in England, like I said, but we automatically have an understanding of what midwifery is. You take care of low risk, healthy, and you have a very easy and straightforward scope of practice. The minute they go outside of that, such as, for example, blood pressure, diabetes, whatever, you no longer, as a midwife, take care of them on your own. You move them up to the next level of care, which is the obstetrician. The obstetrician has nothing to do with maternity care until the complication shows up. No complication, no obstetrician. That model has worked forever and continues to work. So now we've got a dilemma in the States because we've flipped that. We've decided that actually obstetrics is touch and go. And these highly trained specialists and surgeons have to be on standby to make sure it works. And here's the difficulty there, because there aren't enough of them to stand by, right? And then we have absolutely nowhere near the number of midwives we need if we were to replace those high-risk doctors with midwifery. What a dilemma. So now it leaves the rest of us, other community providers and other types of perinatal providers, having to fill in a gap for these specialists. So that question is founded because it's America, right? Because when we talk about midwifery everywhere else in the world, midwifery is integrated and part of medical systems. Midwifery is not fringe out here only. You better go all the way, 100% natural. Don't do this, don't do that, don't touch, don't. All of those things belong in those who choose that. And there are people who choose that, obviously. But in the States, it's a matter of if we're doing a community practice or a midwifery practice, we are now sort of putting our own constraints on, oh, well, we don't do this and we don't do that. It's not like that anywhere else. So I've tried to bring a blend of midwifery, as I know it, as the way I was trained, into this obstetric heavy system that we have in the United States. And so with everybody being able to be finding their autonomy through what we have to work with. So for us, with this JJ model and with the passport itself, we've said, let's blend the two things. Let the patient choose how much intervention they don't or don't want with the system that is their real life system, right? There are many of the women that come through our program who choose, I want this natural birth anyway. I'm going to stay at the birth center. I'm going to have my water birth. I'm going to have, a low intervention birth and a low intervention care. We have people who say, I don't want the Doppler. I'd rather only have the fetoscope. We still have people who want those kinds of very hands-off approaches. We also encourage those people to think about what we're offering is a cross-section. We have a lot more people who want to have hands-on. They want an ultrasound every 10 minutes. God knows why. We try our best to explain, but they want what they want and they are being centered. So we are going to help them have what they want. Do you see? So it's a difficult question to answer directly because we have a mishmash in our model where we are providing options for whatever you say you want, however you say you want it. We are going to support that. We're going to educate, we're going to empower, but you make the final decision because you live here. You are in America. This is what we got. We got a madhouse. So can we help you navigate that safely? And our statistics tell us we're doing it right because our statistics every year come back with barely a premature baby out of maybe 500 people every year, barely a low birth weight baby, a very few cesarean sections, and everybody breastfeeding. So I understand the question. I understand the genesis of the question. We're training our midwives in our midwifery school to practice the low intervention approach to midwifery. But we're running clinics and opening out to our community access points to whatever it is they say they want right now. And we believe them when they say it.
Thank you, Jenny. That was very much, you definitely answered the question. You hit all the points. Thank you for that. Lastly, I know we're almost approaching the closing. Let me make sure I can read this. How can we incorporate the passport into our practice community? I know Brianna shared the email. Do we join your organization? Is that the way?
We'd encourage you to follow. Yes, please. We're building out safe spots. Like Brianna mentioned, 400 plus perinatal safe spots. Those are people like you and me who are already on the ground doing whatever we're doing the best we can, the way we can to match our local situations. So we want you to please consider joining our task force, be part of our movement. We are movement building through the United States, but we also want people to consider that even in your area, there's probably people or safe spots already established that you may not know. Connect with each other, right? So that you can work locally with power, right? So keep that in mind. We're trying to build power so that all of us win, not just our clients, but our providers as well. Okay, so we encourage you to follow us on our socials. Let's run the socials, ladies. Put them in the chat. We've got the Easy Access Clinic in Orlando, which is EA Women's Health, I think, Katrina. We've got the Birthplace, which is in Winter Garden, Florida. We've got the Task Force, and we've got CommonSense Childbirth on Instagram and on Facebook. And we've got the CommonSense Childbirth School of Midwifery. We are training midwives through our direct entry midwifery program. We have a Florida campus and we are opening a California campus. So anywhere you can join in and jump in, please do. We want to grow this movement because the purpose of the movement, again, is to not only support the mamas and babies and the families, but is to support ourselves and each other. We see you. We know you're out there fighting the good fight, and it feels really lonely at times. And it's time to stop all the lone wolf martyr craziness, right? We got to band together. We have to build power together. This is a movement, and we are doing organizing as well as perinatal work, birth work, reproductive justice work, right? In order for us to change this, we must work together.
And I will just plug in that joining National Perinatal Task Force as a member is free. There is no financial barrier within that as well. And there is abundance of resources that we give out.
And we want you on our map. Do you see that map behind Brianna? We want your dot. Come on now. Get on the map.
More dots on the map.
That's
Put
right.
your dot on the map.
Let's go.
Yes, absolutely. So please, everybody, join the movement, join the purpose, join the cause. As we said, these ladies have given us a lot to digest, to ponder on, and a lot to move on. I do want to throw in one last question. What is a next suggested step? I know oftentimes in these conversations, most of us are already doulas. We're in the birthing community. We work in doctor's offices. We're looking into becoming midwives. What about for the common family member, the friend, the neighbor,
Yes.
somebody that said, hey, it's Wednesday evening. I hear Jennie Joseph is pretty awesome and her team is doing things. How do I help? How do I get involved? I'm not a doula. I'm not a doc. I'm not a nurse. What can I do?
You know, that to me, I love that question because the simplest thing you can do is love on whoever it is you love on already and big it up more. You cannot do more pregnant person loving or newborn baby loving or postpartum mama loving. Do that and do it with intention. Do it so you can model for your neighbor to see. Yeah, you feed a postpartum mama. You don't just go run around and bring a baby gift, right? Like we've got to keep we have to re-educate the entire country. And so right now, rather than exhaust yourself trying to do heroic fanciness, do what you can do with what you've got where you are. And keep talking about why that makes a difference for life and death. Right? And those of us that are in the professional side of that work, will keep going as well. But we need you to support us so we can prevail. So keep it as local as you possibly can. Do use your social media if you want to. But it's all about support. The same tenants, we need them as well. We need access, connection, knowledge, and empowerment to do this work and for it to sustain. And you need to fight for your family because you got people right next to you who need you to step up. That's the quickest route to doing it, as far as I'm concerned.
Yes. Do what you can with what you have. I love that because you can start small.
Yeah.
You have to start small to make a big difference. And it's okay. Just start. The best thing to do is just start rather than sitting and waiting and just watching the statistics. Let's start. So everybody start and do your part. I love that message. So we are actually out of time. This has been as a doula, anytime I get more information, it's always beneficial. And Jennie, thank you. Thank you to your team. You guys have shared a lot of insight. The passport is phenomenal. Everybody go and get information to get the passport. Share it with clients, family members, friends, neighbors. Send it on social media. Somebody asked how do we campaign this? We share it. We talk about it. We bring it up. We
See?
get in people's faces. I like to tell people the British are direct, in case you haven't realized. Very direct to the point. Don't like to waste
Right?
time. Okay. So get the information out there. Talk about
Mhm.
it. Be about it. Do your part. So thank you, ladies. I appreciate your time and speaking with us. Thank you all for logging on and sharing your questions. They have uploaded their social media handles, and all of the emails have been posted in the chat. I believe there will be an email going out from Birthing the Magic Collaborative with all of the additional information. So if you had any questions that you didn't get to, or tomorrow you might be thinking, okay, I wanted to ask that too, please make sure you write it down. Okay. I'm not going to age myself, but now I have to write things in my phone. Use a lovely device to put the question in there so that it can be sent out. And so, with that, I want to thank you all for taking time to sit with us. There are more events in the Safer Birth Workshop. Marie will be posting about them. So, in the meantime, please be safe. Please hug your loved ones and keep doing the work, do your part, and stay connected in the community because it's so important. Thank you all.